Hello everyone, my name is Ruffieux, and I am grateful for this opportunity to present our work on behalf of my co-authors. I will be presenting our study of cancer risk in adolescents and young adults living with HIV in South Africa. According to UN AIDS, in 2019, a third of new HIV infections in South Africa occurred in people aged 15 to 24. Adolescents and young adults living with HIV are known to be at elevated risk of developing various types of cancers, both AIDS-defining and non-AIDS defining. That said, studies focusing on cancer risk in this vulnerable population are rather scarce, and those studies that do exist often have a small number of cancer cases or limited follow-up. Our first aim with the study was to determine the frequency of various cancers in adolescents and young adults living with HIV in South Africa. And our second aim was to identify potential risk factors associated with cancer in this population. To achieve these aims, we were fortunate to have access to a large South Africa cohort of people living with HIV, covering the years 2004 to 2014. This cohort is called the SAM study, and it is the result of a probabilistic linkage between two data sources, namely HIV-related lab results from the National Health Laboratory Services and cancer diagnoses from the National Cancer Registry in South Africa. For this study, we followed up adolescents and young adults starting from their first HIV-related lab test or measurement and until they turned 25 or until 6 months after their last HIV-related test. We computed adjusted hazard ratios for the most common types of cancers using Cox proportional hazards regression. For the cancer classification, we made use of the ICD-03 recode for adolescents and young adults. We had data on nearly 800,000 adolescents and young adults living with HIV. The vast majority of this population was female, and 22% was below the age of 20 at their first HIV-related lab result. 867 of those individuals were diagnosed with cancer during their follow-up period, and you can see the distribution of the most common types of cancers in this table. Nearly half of the cancers were Kaposi sarcoma. The other AIDS-defining cancers, so non-Hodgkin lymphoma and cervical cancer, were a bit less common. The majority of the cancers occurred in female individuals, although do keep in mind that 90% of our study population is female. Most of the cancers were diagnosed in patients aged 20 or above. Here you see an overview of the associations between various risk factors and the four most common cancer types in our study population, namely Kaposi sarcoma, cervical cancer, non-Hodgkin lymphoma, and Hodgkin lymphoma. Older age was associated with a higher rate of Kaposi sarcoma, with an adjusted hazard ratio of 1.4 when comparing those 20 or above to those below 20 years of age. Male individuals were at much higher risk than female individuals of developing Kaposi sarcoma, non-Hodgkin lymphoma, and Hodgkin lymphoma by factors of 2, 3, and 5, respectively. The incidence rate of Kaposi sarcoma decreased over the study period, with the hazard decreasing by a factor of 2 when comparing the last 3 years of this period to the first 4. Higher baseline CD4 cell counts were strongly associated with lower rates of Kaposi sarcoma, cervical cancer, and non-Hodgkin lymphoma. We also found marginal evidence of such an association in the case of Hodgkin lymphoma. To summarize, infection-related cancers such as Kaposi sarcoma and non-Hodgkin lymphoma were the most common types of cancers in our study population, which was made up of nearly 800,000 adolescents and young adults living with HIV. The risk of these cancers was higher in individuals with a lower CD4 cell count. As a result, there is a need to encourage early ART initiation and to improve adherence to ART in this vulnerable population. For full disclosure, an article containing the results presented here was in press at Lancet HIV at the time of this recording and may have been published by the time of this conference. To finish, I'd like to thank the institutions and the personnel who contributed to this study. Enjoy the rest of the conference.